I'm Beverly Kirk with the Global Health Policy Center here at CSIS, here with Dr. Michel Kazatchkine. He is a member of the Global Commission on Drug Policy. And thank you very much for being here to talk about this new report that calls for some pretty dramatic changes in global drug policy. And it's a focus on health rather than on criminalization. Can you speak more to that?
Right, and since the first report of the Commission in 2011, that has been a recurrent theme of our reports. It is shift the paradigm from prohibition law enforcement to more humane health and social-oriented policies. Now we say indeed that health should be the priority of a drug policy, that drugs is about health. Drugs is not about policing. And having health at the center of a policy means that it's the safety, the health of the individual and of the community that should be not only be the aim that we pursue, but also the way we assess the success of our policies. So switch from assessing the achievements of a policy on how many people have been prosecuted, arrested, incarcerated, or how much drugs have been seized, or how much crop fields have been destroyed, and look at really measuring what we want to achieve, which is, are we reducing the rates of transmission of HIV/AIDS, hepatitis? Are we reducing the number of overdoses and deaths? Are we reducing crime and violence? So put in place the measures that will primarily promote health. And that is, of course, financing harm reduction at large scale. That is financing prevention for people not to go into drugs in the first place. And then for people who take drugs, preventing them from becoming addicts, problematic users, and for people who are problematic drug users, go to treatment rather than go to jail.
Is there evidence that this has worked?
There is ample evidence that harm reduction works. That is that with programs such as needle exchange, opioid substitute therapy, safe injection rooms, measures that we in our technical language call harm reduction, that this has significantly impacted the spread of the AIDS epidemic. For example, in Western Europe, in my country, France, there's no more people injecting drugs that becomes infected with HIV. To the contrary, in countries that have harsh prohibition law enforcement policing practices and that deny somehow the benefits of harm reduction, like the Russian Federation, this is the only region of the world where the AIDS epidemic is still growing at a very fast rate.
For those who might be critical when you put out the idea of decriminalization and a legalization, are you really talking about legalizing all drugs? There are critics who would say that would actually be more dangerous to society.
Yeah, so let's be careful and go step by step. We are indeed, as you say, promoting decriminalization and then legal regulation of drugs. But these are difficult concepts, and I fully take your point that this cannot be easily accepted by the public opinion or by a politician or by a parliament, because these people fear that they would look sort of soft on drugs, and that's not where the public opinion is at this point. There are countries, as we were just discussing, that are still below where they should be in terms of accessing harm reduction and support to people and putting in place prevention. Then there are countries that are at this stage but are still criminalizing use or possession. Criminalizing means a criminal record for a person who is arrested. And a criminal record is something that stays with your life and prevents you from opportunities for housing, for employment. It's really ruining your life for whatever. You were arrested because you had a few grams of marijuana. It's totally disproportionate sentencing. It is so. We are saying that criminalization of use and possession is a waste of money. It brings no benefit to society. It just stigmatizes the people. It fills prisons with people who should not be in jail, and it ruins the life of young people. And we should rather invest the money that goes into these programs to money that would help prevention, care, support, and treatment. And then one step further is the issue of legalization. So let me be very clear here. If you say the Commission is promoting legalization of drugs, it may sound as if we're saying tomorrow, all drugs are legal, all drugs are free, and that's not what the Commission is saying. The Commission is saying that currently the drug market, which will not stop, because there will always be demand, the drug market depends strictly and is regulated by criminal organizations. They are making the money. They are setting the rules. They are putting the new products on the market. What we're saying is that we want the control of the drug market to be brought to the governments, taken out of the hands of the criminal market, of the criminal organizations, into governments. That is for the government to regulate drugs just as we regulate tobacco. Drugs are potentially dangerous. They can be pleasant and recreational for many of them if they're used wisely and if they're of good quality. Why wouldn't the government take on this job and responsibility to promote and protect the health of the people rather than leave it to criminal organizations?
How tough a sell is that going to be, though, for governments around the world? In this country, the experiment in Washington State and Colorado with marijuana has fostered a considerable debate.
Yeah, a difficult sell, Beverly. We're not saying this will happen, from one day to next. It will take a lot of effort. And I have been following what's happening in this country with Colorado and Washington. I understand next on the list will be Oregon, Washington, D.C., California, to speak and to vote on these issues. But at the same time, just think about where we were in 2011 when we at the Global Commission launched our first report. Our slogan was "Break the taboo." Open the debate, because there was no debate. Mm-hmm. And now I'm seeing a genuine debate underway in many countries in the world. I see openness to that debate. I see people fed up with overpopulated prisons and with criminalization. As Richard Branson was saying in our seminar today, if you ask someone on the street, if your child is using marijuana, would you like him to be sent to a jail or to be referred to a medical officer? The answer is obvious. So I see the debate moving. Let's hope that it will move further and accelerate as we move to the 2016 special session of the United Nations on Drugs.
All right. Thank you so much for being here.
Thank you.